Curtis. Now, there's plenty happening in Canberra today. We'll go right back to Parliament House now. The Green Senator Richard Di Natale, the Liberal MP Mal Washer and the Independent MP Rob Oakeshott have spoken just in the last hour or so. So we'll take a listen to this now. They've been speaking about drug law reform.
We met today across party lines. We've got Mal Washer, myself, Rob Oakeshott. We've got members of the Labor Party who are also involved in a discussion about how we progress the issue of illicit drugs policy and drug policy reform in this country. It is an incredibly important issue. It's a pressing issue. And there's momentum building right around the world to get a much more rational, evidence-based approach to illicit drugs policy. We today have decided that we are going to push for a referral to the Productivity Commission. We think that's the best way to get some hard-nosed analysis of the problem, to take the politics out of it, to take partisanship out of this issue, and to try and get Australia on a footing towards a much more sensible, rational and evidence-based policy around illicit drugs. Really important. People are dying because of the approach that countries right around the world are taking to this very, very important issue. Our plan is to have a meeting that provides a briefing to all members of Parliament. We're very, very lucky here today in that, in fact, there are, I think, 4 doctors. We've got myself, Mal Washer, Professor Bob Douglas and Alex Wodak, all medical doctors who want to see the issue of illicit drugs looked at through the prism of health rather than a legal approach. We need to take this issue out of the realm of being hard on drugs, tough on drugs and penalising people who have problems with substance dependence, and treat this problem through the prism of health policy. And that's where it needs to be. I'll just hand over perhaps to Mel and Rob to say a few words on that, and then I'd just like to introduce Bob Douglas and Alex Wodak also to say a few words, and then I'll let you ask some questions about perhaps some other matters. But this is a really important issue. We are going to be spending some time in this Parliament trying to advance the issue, a non-partisan approach. We'll have a briefing for all MPs coming soon involving the Australia 21 group who are advancing this issue through the work that they're currently doing, and then we hope to be able to get some support for a Productivity Commission referral. So I'll just hand over to Mel and Rob.
Well, thanks. And I'll hand over to Rob in a second too here. But basically this is about drug law reform. This is what we've come down to talk to you at the moment, and I'm sure we'll take some questions on other matters in a second. But what Richard said is true. What is happening in this country now doesn't work. So there's room for change. It frankly just doesn't work. And by that I mean that illicit drugs, we're talking about illicit drugs at the moment, are more freely available on the streets than ever before, and probably cheaper than they ever were before. So prohibition as such, and putting all your money into border protection on these issues and policing alone has not solved this problem. Now, of course, we don't want to stop that, but we need to focus on this being a social and health issue. So when people have the desire to take illicit drugs, and if they become addicted and dependent on them, then we try to get them off them naturally. If we can't, then we do it in a humane way. We manage that and treat these people. At the moment, they get criminalised, marginalised, they can't be employed and wind up in our jails, and that's not the end result we'd want to see if it could be done in a social and health management. And so that's where we've got to start thinking differently, putting our money there, be compassionate about this and address it, so I don't have the drug lords and the criminals dealing with your kids and grandkids. We have doctors and social people and social workers that deal with them humanely. And that's what I'm going to leave and hand over to Rob.
Thanks, Mal. Thanks, Richard. Thanks all the doctors here, and to old friends like Anne who are here today. Look, since the mid-90s and the Drug Summit in New South Wales, I've been a long-term advocate of evidence-based policy in regards drug law reform. And when a couple of doctors in the building come and say, what do you think about a reference to the Productivity Commission, I'm certainly an advocate for that, and hope we can get a majority of members of Parliament to do likewise and support that. As Mal just said, business as usual leads to costs to government, costs to the taxpayer and costs lives. And if we can at least have a look at the range of options available to all of us to find a better way and a cheaper way of doing things and a smarter way, I think that is the role of being in this building and trying to find that way forward. So thanks for those that have proposed it, Richard and Mal in particular, and hopefully we can get this idea to the Productivity Commission sometime soon.
Well, can I get Professor and Alex to
step right up to the mic?
Yeah. I'm been involved with the Australia 21 initiative on illicit drugs, which issued its report 3 months ago. It has generated a major public debate about why we're doing what we're doing with the whole illicit drugs. In the 30s, prohibition didn't work for alcohol, and in the 2000s, prohibition does not work for illicit drugs anywhere in the world. And we are wasting huge resources on criminalising large numbers of our population and putting many of our young people in jail. And in fact, we're still losing 400 people a year from illicit drugs. So we don't say there is a clear best way of doing this. A lot of countries around the world are doing different things. Australia 21 is attempting to pull together.
We'll just break out of that there because the Prime Minister of the Tibetan government in exile, Lobsang Sangay, has just begun a media conference